Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one. Question number one states a 25-year-old female presents with a Harold patch, a large oval salmon colored lesion on her trunk, and a smaller oval lesion that follows the lines of her ribs. She denies fever, pruritus, or systemic symptoms. Based on these clinical findings, what is the most likely diagnosis? Is it A, psoriasis? Is it B, tinea corpus? Is it C, pityriasis rosea? Or D, ringworm? Take a moment and tell me what you think in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, based on the clinical findings, what is the most likely diagnosis? Y'all know I always tell y'all, if they're looking for a diagnosis, you need to run it back and look at the assessment findings, right? So we have a 25-year-old female. She comes in with a Harold patch, large oval salmon-colored lesion on her trunk. Y'all, this already is classic, right? Harold patch, classic for pityriasis rosea. Salmon color, classic for pityriasis rosea. And everything I tell y'all about derm, location, 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 because the description is going to have to give you a clear picture so you can think of what this skin issue is, right? So the location matters. And pityriasis rosea is commonly found on the trunk, right? So your best answer here is C. All right, question number two. A 24-year-old female presents with a diagnosis of pityriasis rosea. Her symptoms include pruritus and the appearance of multiple oval salmon-colored lesions on her chest and back. She is otherwise healthy and the condition is in an early stage. What is the most appropriate treatment option to manage her symptoms? Is it A, it will resolve on its own? B, oral antibiotics to prevent secondary infection? C, oral acyclovir for the viral suppression? Or D, topical antifungal creams for the fungal infection? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, what is the most appropriate treatment option to manage her symptoms? So again, when we are talking about treatment options, right, you want to look to see if they have provided you with a diagnosis. And in the event that they have not, then you need to take it back a step further and look at those assessment findings. But here, the diagnosis has been provided, and it lets us know that she has pityriasis rosea, right? So how do we treat PR? PR is typically treated as it resolves on its own. Now, I do want to say a sidebar because she does have some pruritus. You can do like the cortisone creams, topical things like that to kind of help with all of the itchiness. But the standard treatment is it typically resolves on its own in 4 weeks. Okay. All right, in question number three. A 22-year-old female presents with a rash that started as a single large oval lesion on her back, followed by the development of smaller, similar lesions in a Christmas tree pattern rash. She denies a recent viral infection or other systemic symptoms. What is the characteristic feature of this patient's rash? Is it a confluent erythematous plaques? Is it B, Harold patch followed by secondary lesions in a Christmas tree pattern rash? C, asymmetric target-shaped lesions? Or D, bullous lesions with a central necrotic area? Take a moment and tell me what you got. All right, so stem the question states, what is the characteristic feature of this patient's rash, right? So what's going on? We have a 22-year-old female who presents with a rash that started as a single large oval lesion on her back and then developed a smaller, similar lesion of a Christmas tree pattern rash. So what is this really saying to you? B is your best answer. That's the Harold patch that was found on her back, and it's followed by those secondary lesions and the Christmas tree pattern rash, which is the classic presentation and progression of pityriasis rosea. And I wanted to display this question this way to you so that you're able to see the description in various aspects, because sometimes, when we study, and how I tell y'all, a lot of issues are that you study things in a blanket like overall fashion. So you're going pityriasis rosea, Harold patch, Christmas tree pattern rash, but then when they say there was a large oval lesion on her back, then went to the Christmas, you're not thinking that they're describing a Harold patch. So I want you to see it in all aspects, so you're filling those gaps and not missing things for small variances like that, okay? Because I want you to see the full picture so you're studying effectively. All right. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. All of the things that I do offer are linked in the bio of this channel, as well as my website. So you will see all of my standardized options. Now, if you're looking to book any of my one-on-one sessions or any of those personalized reviews, I always say either call, text, or email, as I offer a variety of those session types. And I have removed those from the website so that I can speak with you guys to gauge what you truly need to make sure that you're booking the appropriate session that is going to benefit you the most, okay? So I hope that's making it a little bit more helpful for you guys. But feel free to reach out to us, and I look forward to talking to you. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.